Do you show more gum than teeth when you smile? Learn all about a procedure where the lip can be repositioned to fix this exact problem. Today on The Younger You.
I'm on top of the world, now I'm living, and the good just gets better, keeps on giving. Not even close to the end, it's just beginning. Life is getting lighter while the days are getting brighter, yeah. And it's a good, I won't even worry anymore. Took all my cares, still can kick them all out the door. Go on and try, come and tell me what you're waiting for. Move and keep them going till your life is overflowing, yeah.
Today we're going to see two types of dental procedures. We'll be discussing a lip repositioning procedure that can correct gummy smiles and help make your smile more balanced and beautiful. And also we'll meet a young girl that has a family history of gum and tooth disease who will also be getting a whole new set of choppers. Dr. Medden is the doctor who is performing all of these surgeries for us. Welcome to the show, my friend. Nice to see you again.
Nice to see you too.
Okay, let's talk about what the public know is a gummy smile. Explain that to us.
Well, a gummy smile is when there's two situations. One is usually the patients have a retraction, hyper retraction of the upper lip, and then there shows a lot more gums that they want to. The other one is created by too much gum in the area where the teeth look way shorter.
So it's definitely an aesthetic problem when you see it. Is it, are you born that way or it happens over time?
Sometimes it happens, well, they're usually born that way when they comes with the hyper retraction of the upper lip.
Gotcha.
The gummy smile, I mean, the gums, they actually may overgrow due to sometimes medications, sometimes other conditions that they may have.
Okay, I want you to talk me through the procedure of this surgery. Is it complicated and what will we be seeing today?
It's not really complicated.
Okay.
I mean, it may seem complicated, but it's a simple procedure that is usually takes about, sometime about 45 minutes to an hour.
Oh, so it's lunch break procedure.
Yeah, pretty much you could say that. And what we'll be seeing today is just a patient that has a hyper retraction of their upper lip.
Yes.
And so she's showing a lot of gum in that, like we call the gummy smile.
Yes.
And therefore we reposition that lip with doing a procedure is an incision that is made from one side of the inside of the lip to the other side, and pretty much by the molar area, and therefore making a reattachment. So we detach all those tissues, all those connected tissues, and then what we'll do is we'll just reconnect them again.
Okay, that sounds a little painful. Is there a lot of pain after the surgery?
Believe it or not, it's not.
Okay.
And usually my patients, what I ask them afterwards, if there's, sometimes they may have a little bit of discomfort, but not a painful procedure. And sometimes there might be bruising, though my patients so far, I really don't have any.
Okay, well this is an interesting fact that I got off the internet and from the American Society of Plastic Surgery. Over 26,000 people had lip augmentations in 2014 and that number is up by 40% in the last 15 years. Are you finding more and more people are now realizing this is something that can be done?
Yeah, well you touched something really essential on this procedure. This procedure is to actually reposition the lip, just like the way we said, reposition the upper lip. But one of the things that the side effects that you get out of repositioning the lip is that the lip looks more augmented, if you want to call it that way, kind of a more beautiful upper lip.
Yes.
And therefore it's a lot, mostly women love this situation just because the upper lip looks a lot better.
So Dr. Medden, we're talking about the second procedure now, and you did a ginormous amount of dental implants. Is it anything similar to what was known as dental bridging? Are they two completely different type of procedures?
Yes, both of them are different. One, bridging, like you mentioned, is to place a bridge between teeth to add the teeth that are missing in that space. Now these days we could actually place implants individually,
so
or we could bridge the implants.
Okay,
too.
a bridge is four or five sets of teeth at once, and it's just placed in.
Yeah, usually between 3 teeth.
Yes.
That's what it starts. 3 teeth to 4 teeth, 5 teeth. Yeah.
I didn't think they were still happening. Is it still something people ask for, and is it covered by their insurance?
Well, that's a great question. What happens is that sometimes it's dictated, unfortunately, by the insurance. So the insurance first of all, they may say, okay, we don't cover implants, so then the patient is only left with doing a bridge, or B, they may say, oh, we only cover a little bit of the implant part.
Right.
So then the patient has to decide whether they want a bridge or they want an implant.
Well, in your opinion, in your professional opinion, what do you prefer to see in the final result of someone's mouth? A bridge or an implant?
Well, the implant is the number one situation to place on implants. The options, as you said, the number one option will be implants.
Dr. Medden, here's an interesting fact for you, and I want to ask your professional opinion. According to the American Academy of Implant Dentistry, 15 million people in the US have crown and bridge replacements for missing teeth, and 3 million have implants. That number is growing by 500,000 people a year. Is that number high to you? Do you think that's a high stat?
No, I don't think it's high. I think it's just people being more aware of what dental implants could do.
Dr. Medden, thank you so much. After the break, we're going to head over to Dr. Medden's office and meet our first patient, Ginger.
Looking for the perfect beauty product? Each week, The Younger You highlights a standout product in the health and beauty industry. Head over to theyounger.you.tv and check it out. Love to hear your comments.
It's time to introduce Ginger and find out why she's having this procedure done, and then we'll get to see Dr. Medden perform his magical surgery.
My name is Ginger, and I am 38 years old, and I am going to get the gummy smile procedure.
I'm here with Ginger, my patient that we are going to she has a gummy smile. She expresses a lot of gums when she smiles, and which she's not pleased with. And the other issue that she has is that her teeth, she has old veneers that we are changing just because she has some rosations in some areas. So we had already lasered her gums. What I'm planning to do right now is gum repositioning, which is to get rid of the gummy smile that the patient has. So what we'll be doing is doing an incision that starts in one side of the upper lip area on the mucobuccal fold, which is the inside of the lip, and to the other area, the other side.
Basically, when I smile, you can see my gums. My top lip disappears. It's not attractive. I've always really hated pictures that were taken of myself, and I most recently noticed we have a website for my work, and we had all of our biographies and professional photos taken. And I was really upset when I saw the pictures because of my smile. The pictures in themselves were gorgeous, but every single picture, I don't feel like I look like that, or maybe I do, but bottom line is I wasn't happy with that, and it's been something that I haven't even really shared with the picture with people. And you know, when you take a professional picture, you have something that represents you as a person, you want it to look pretty and you want to be proud of it. Unfortunately,
Most people don't realize that sometimes they can have a gummy smile, or they haven't really noticed it. These days, I think, my personal opinion, sometimes people are getting to see themselves to have more gummy smile, maybe because they're taking selfies, or they're using a lot of these phones, and then before, even though years ago, before selfies or anything like that, or any cell phones, haven't taken their own pictures. We used to have family pictures and you used to probably see them from far away, but now having all these close-up pictures that the people are taking, and they're using the media such as Facebook or whatever, sending pictures, and they might say, oh, this person has a gummy smile, or this person look at this smile. So they're critiquing themselves a lot more.
I honestly didn't even know a procedure like this existed, and I thought somehow over time you could train yourself to smile a certain way so that that wouldn't happen during pictures, but you can't help it. It's so involuntary. So I haven't been happy with my smile my whole life, and just knowing that I can get something, to me, your mouth is everything. And the industry that I work in, I'm talking to people all the time. They're coming to me for advice, for beauty, and you know, I have to smile at people during the day. And so to be able to do that and not feel insecure about it, it's gonna be awesome.
What I'll tell my patients is when they have this procedure is they have to be really careful for the next 4 weeks. So for the next 4 weeks, they have to really not lift up the upper lip. Sometimes patients get curious and say, oh, to their friends or family, say, hey, look my incision. So you don't want to start pulling those areas just because remember the tissue there in that area is way thin. So we have placed numerous sutures in that area. So you don't want any of those sutures to rip because then the surgery will be affected by if something rips. So then you have to make sure that you take that in consideration with the patients and let them know.
Let's just say that my brother my oldest brother, and I have forgiven him, but he would call me Mr. Ed. And when I told him I was getting this done, and you know, we joke a lot, he's my older brother, older brothers always do that, but when I told him I was getting this done, he's like, there's not gonna be any Mr. Ed anymore. And we laughed, and he's like, he was happy for me that I was getting something done that is gonna make me feel good about myself. So it was something that maybe people have noticed, they wouldn't bring it up, but I'm a very honest person and I'm honest with myself, and I point that out. Like, I don't like to smile because I hate my smile.
Smile, babe. Okay, so her lip is, obviously we get one aesthetic on this side at the end, so she's lower on that side.
I think that we as women are definitely harder on ourselves. So it's not an outside source telling you, oh, you're not pretty enough. But it is something to do with your own confidence. And I feel like if you're willing to take the step to do something to make yourself look better, it just makes a big, huge difference. How is it changing my life? I'm gonna love looking in the mirror. That's how it's changing my life. I mean, who doesn't want, you know, if you have a pretty figure, a pretty shape, you want to look at yourself. You're excited to put clothes on. You're excited to go shopping. You're excited to see people. It changes everything.
Closed captioning of The Younger You is brought to you by Circle of Life Women's Centre.
Looking for the perfect beauty product? Each week, The Younger You highlights a standout product in the health and beauty industry. Head over to theyoungeryou.tv and check it out. Love to hear your comments.
Now let's meet Kaya and find out why she's going to get a whole new smile.
Well, good morning, Kaya. How are you?
I'm
How
great.
you doing?
Yeah.
Good to see you. Are you ready for this today?
Yeah, I'm really excited.
Yeah. With Kaya, she was a very special case, as you say, just because she had severe broken down teeth due to caries lesions, lack of hygiene, I guess, during the early part of her years. And then she got a lot better, but then financially she couldn't really afford to get all these teeth done. We couldn't really move into having fillings just because it was going to just be like kind of like a band-aid situation for her, but not really getting her from point A to point B.
My teeth, well, part of it's like poor genetics, like my mom has very poor teeth and like she gets that from her dad and things like that. And then another part of it is that like through most of my adolescence, my family didn't have insurance. And so, you know, it was hard to get work done already having that like poor enamel and everything built in from my genetics. And so I've just been, you know, dealing with having not ideal teeth for most of my life.
So we just kind of putting things together today when it comes to restoring them. Okay. So you excited for that?
I'm so excited.
Okay.
I'm
All right.
nervous. I can't wait.
Let's open a little bit. Give her the smile that she deserves, also making sure that her bite is totally established and something that's going to last her for many years. Not only that, but she's going to get the confidence out of being a young person, 20 years old. It's going to start kind of in the right foot with having this done, and it's going to give her kind of a self boost because of the lack of she wouldn't be able to smile really to show the teeth that she had. And she came up to me and she said that she was really concerned about her smile. That's when I got together with the lab and we decided to do this case.
My friends, all my peers, their biggest insecurities are like, their eyebrows or their skin is breaking out, things like that. Things that are like really easy to, hide or fix or get something done on. And mine is like, oh, I'm just not gonna smile in any pictures,
All right, so we're going to start with you. I'm going to start with the gums, okay? So we're going to make him look a lot better, a little bit more ideal. And if you have any discomfort, please let me know.
Getting ready for the day before school and, you're really concerned about your appearance, everything like that. And then, you smile and you're like, oh, that kind of like throws it all off when you have bad teeth. And so it's like you just kind of, it's almost like a subconscious effort where you just almost train yourself just to like speak with your mouth as closed as possible and not to smile as much.
What we're doing right now is we're going to recontour her gums so we could give her a better aesthetic result with when we finalize with the veneers. Due to the gum disease, she has some gum disease that we had to control at first through some work that we did at the office, and we laser her gums too, and we control that situation with the gums. Then after that we restored the teeth. And this procedure is actually done pretty much all in one visit.
I'm always looking at everyone's teeth, like whether it be my friends, because it's like, oh, their teeth aren't that great, okay, I can smile around them, and not feel uncomfortable about it. And then it's always, I'm watching a TV show or something, first thing I look at always is someone's teeth because I'm always so worried about mine.
Yeah, this that we're doing now is just we're going to give her the temporaries that she's going to wear for about a couple of weeks until she gets her work totally finished.
I've been living with this for so long, it's like almost second nature, I feel like, to where I've even noticed that when I talk sometimes, I keep my mouth more closed than I would normally, just because I'm so like nervous about someone like seeing my teeth and judging me by it. Within the 2 weeks, we need to really step up on oral hygiene. That way those temporaries stay, not the temporaries, but the tissues around the temporaries stay healthy. Temporaries don't make the tissues healthier. They actually, in the contrary, the gums tend to go bad, or not bad, but tends to go really red and puffy during the temporary phase, just because there's a lot more bacteria that attaches to it. But there's ways that we use to minimize that, so that way when we place the permanent ones, the gums are healthier. What I'm just nervous about is just getting it done, because it's going to be so different. The past couple weeks since I've known this was going to be done, like I've been, like looking in the mirror thinking like, I'm going to have to learn how to smile again, Like I don't know like how my smile will be, when you try and like practice right now, but it's like with the way my teeth look, it just doesn't look right. And so I'm going to have to, just to relearn that, basic like skill. And that's just something you're just supposed to do, but because I've like trained myself so much not to smile, it's going to be really hard to just be able to have a natural smile. She had a lot of work done, and many of the teeth needed kind of some extra work, but we got it all accomplished, and then she is now at the point that she just needs to maintain these teeth. It's going to be a life changer, because from this point on I'll be able to be out there, be as outgoing as I want to be, and just never have to worry about it.
After the short break, we're going to be in the studio with Ginger, Kaya and Dr. Medden to check out the results and see if the girls love their new looks. Girls, welcome to the show. It's so nice to see you all finished and completed from what I've seen on the journey. Dr. Medden, incredible job.
Thanks.
Amazing. You girls feel great?
Yes.
Okay, you ready both to see your before and after shots?
Yes.
Okay, Ginger, let's take a look at yours first. Oh my gosh, Ginger, you look absolutely stunning and such a huge difference. Your gummy smile, Gone. You're
Yes,
excited
it-
about
Oh my! It's changed everything.
it? Kaya, let's quickly look at your before and after shots as well. Oh my gosh. I would never have thought that was completely possible. How old are you again?
I'm 20.
20.
Yeah.
How does it feel to have that incredible
It feels
smile?
amazing.
Does
It's
it?
indescribable.
Really?
Yeah.
Do you feel that you've got more confidence?
Oh,
and
definitely. You know, it's
Really?
like totally different. You know, all my friends, it's like, oh, Kaya's smiling in every picture. What? And it's just
Do people
total difference.
people say that like about you as well?
Well, I've always been a big smiler, but
Yes.
it seems to me that lately I'm smiling all the time from ear to ear, even when I'm having a bad day.
Okay, Dr. Medden, I asked him earlier on in the show whether there was a little bit of pain from having the procedure. He says not too much, it's okay from having
Yeah.
your gummy smile repaired.
I agree with him. It feels more like pressure than it does.
Okay.
It's more pressure than it is an actual painful experience.
And how long was that feeling for?
Just that night, honestly.
Okay, interesting.
Just that
You were
night.
right. I noticed that you've had a little bit more work done than just the gummy smile. What did you do here?
Well, we did a combination with her. Her case was actually, she had a gummy smile, so we did the surgery, and also placed veneers. So we placed an upper veneers on her, so it changed her smile, because she had all veneers that they were done some years
And
ago.
well, that's
they
what
were
I
not
was
done
looking at
well.
with the
Yeah.
before and after shots. I'm like, I thought we were just doing the gummy smile to begin with, but you thought while you're in there, why not have a bit more
Of
work done?
course. Of course.
Okay, did you not take care of your teeth when you were younger?
when I was younger, I tried, but not having insurance, you know, through like most of my adolescence and growing
yeah, of
up,
course.
you know, it was really hard to like get into the dentist when I was growing up.
Did you go to the dentist at any time?
Yeah, we did. Like I did get into the dentist, but not nearly as often as I should have been.
It's quite a severe case that I saw on Kaya as well, isn't it, Dr. Medden?
Yeah, she was a younger, young age, 20 years old, with this severe decay on all the teeth. That has been going on for some years. So that's in Kaya's case, I approached one of the labs that we work with, Treasure Dental Studio, and they were willing to actually do the work at no charge. So
Wow.
then the same thing with me, I just decided to offer my time. And so because Kaya, I think it was going to be, she was going to need this work, not only fillings, but she needed something more aggressive to take care of the situation. So,
Do you think you will take care of your teeth from here on in?
Oh, definitely. Yeah.
Well, but sitting beside her, Ginger, what do you think? Like looking at those, incredible.
They're beautiful.
Because it's really, and it's something I want to say to you, you have taken care of your teeth over the years, okay?
Yes.
You've had crowns put on and implants and things like that, but you had a gummy smile. What message do you say to young girls when you see these before and after shots on Kaya?
I think that having a beautiful smile gives you confidence. You
Yeah.
smile a lot more, and when you smile a lot more, you're happier.
Do you feel happier?
Yes.
What do your friends say when they see you?
Like, oh my God. Like, my best friend, the first time she saw it, she was freaking out. She's like screaming like, oh my God, Kaya. And so like, she could see a total difference in just like my confidence and the way I was like presenting myself compared to before where I like wouldn't really smile.
I know, I was told you were really quiet and meek and mild. I'm like, this girl's got a bit of sass about her. What do you want to do in your career?
Filmmaking.
Do you?
Writing, yes.
Are we doing okay here today?
You're doing all right.
It's always nice to be critiqued.
Yes.
Now, you're a hairdresser by trade.
Yes.
So it's really important to have that perfect smile. Me also being a hairdresser in my past as well, it's all about the looks.
Now
about-
I'm taking selfies. Before I would not take selfies. That was a 2-hour process.
When you hear a story like that, and when I say this, and someone that's older, an older woman, do you think, I'm so glad I had this opportunity?
Yeah. And now I can be, you know, confident the whole way through.
Yeah.
Instead of
What do you say to this bloke who's done such an amazing job?
Thank you.
Thank you so much.
Thank you.
you're very welcome.
You look absolutely stunning, and I wish you all the best because I know what it's like to be around people who have great smiles and you don't. So, but now you do. congratulations. Thank you for showing me your work as well and being patient with us. We appreciate it. Well, the short distance between two people is a smile, because our smile is the first thing that people notice when meeting each other, and a good smile can really boost your confidence and give you a great first impression. Now, Ginger and Kai can go through life without having to hide their smiles thanks to our good friend, Dr. Medden. Well, for more information about the show or Elite Smiles, head over to our webpage at theyounger.you.tv, and I'll see you next week. Coming up next week is part 1 of the Total Body Makeover. Watch as we transform Deanne and help her get her confidence back.
The Younger You set provided by Madison McCord Interiors.